Look out, look out. Tuesday means Peter Mullen joins us for Health and Wellbeing. Peter, good afternoon firstly.
Good afternoon, Mark.
Look, great to be back with you again. This week, it's all about men's health. In fact, it's all about some natural remedies for prostate cancer. What do we have for us on the big show today?
Look, prostate cancer is one of the most common cancers diagnosed in Australia after melanoma, and the third most common cause of cancer death. So, and yet men still seem to have trouble talking about it. So I thought today, a bit of a focus really on men's health, things to look out for, and, hopefully ways that we can go about reducing our risk or prevent the development of prostate cancer.
And Peter, this time around, prostate cancer, blokes, we generally don't look after ourselves as much as the ladies do. We tend to wait till the last minute, we wait till something's wrong, and by then sometimes it can be too late. What is it about us? We don't like getting things fixed up.
Well, I think it's one of those old sayings, isn't it, that men's motto, if it's not broken, why fix it? So I do think it's a thing with men's health that we do tend to leave things to the last minute and, think that we've got to tough out maybe some of these early warning signs that there's issues going on.
I think as well we don't like to be seen or perceived to be seen as weak or any of that sort of stuff as well. I could be wrong, but I don't think I am.
Well, look, a big part of, from a naturopathic point of view, a big part of our belief or focus is around the whole point of prevention is better than cure. So, and you can make all these changes, you can do everything you absolutely can and, really work on having fabulous health and still end up with something that has to be dealt with medically. Sure. However, I always say you can't guarantee what's going to happen in the future, but if you did have to go on to have some sort of treatment or surgery or whatever, you're going to cope so much better with that if the rest of your health is good as well. So, but as much as we can, there's a lot more research showing up these days about what we can do to help prevent or lower our risk of things like prostate cancer.
So I guess in terms of risk factors for prostate cancer, the big one's going to be age?
Yep, absolutely, and increasing rapidly over the age of 50. So everybody at 50, every man at 50 should start to then think about having regular checks on things like their prostate.
Great, something to look forward to down the road.
Well, look, the early stages of prostate assessment is based around symptoms, maybe having a blood test for a PSA. But as everybody knows these days, PSA is not really a marker for cancer, but it's a marker for prostate inflammation. But having a history of PSAs can give you some clues whether things are changing as well. So getting tested regularly, starting from the age of 50, just maybe, I think it's valuable. And then, if symptoms start to increase, then obviously there's, further investigation.
How big of a role does family history tend to play in terms of prostate cancer, Peter?
Well, family history of prostate, but also breast or ovarian cancers. Prostate's in the family of hormonally aggravated or triggered types of cancer, same as breast cancer and ovarian or even uterine cancer as well. So if there's a family history, if a lot of women in the family have had breast cancer, then, from a male point of view, there's going to be an increased risk of prostate cancer as well.
So that there's a crossover there?
Yeah, absolutely. Hormones play a big role with all of these types of cancers. A diet high in fats, low in fresh fruit and veggies. So again, there's a lot of stuff coming through about, and I'll talk a bit more later on about what sort of vegetables and how little you actually have to eat to actually have a big impact on your cancer prevention. And, they've found that, a big association between diets high in fats, red meat and dairy. So they're the three things that we're going to look at trying to reduce, increasing all your plant-based stuff as well.
We seem to talk about this at least every second week, isn't it? Where you're getting off more of the bad foods, getting onto more of the good foods. You increase your chances of not getting these nasties that come along.
Yeah, absolutely. Diet's really the cornerstone, and one of the big risk factors or aggravators for prostate cancer is hormonal changes, as I was talking about. But one of the hormones that may play a key role in prostate cancer development is insulin. So we've talked before on the show a lot about excess carbohydrates can lead to an overproduction by the pancreas of insulin due to insulin resistance, where the insulin doesn't work to get the sugar out of the blood as well. So insulin has been shown to have a growth hormone-like effect, possibly on cancer cells. So being overweight, being obese, having elevated levels of insulin, and then insulin also is a major regulator of other hormones as well, is a massive risk factor for both prostate cancer and breast cancer as well. So again, not just the bad diet, but the effect on our hormonal balance from that bad diet.
So in terms of hormone changing, how I guess you've mentioned overweight, you've mentioned diet. What are other things that we could pick up on then to go, hang on a minute, I think there's a change there? How would we pick that up ourselves?
Like signs and symptoms that there could be some issues coming on. The old story used to be, when I was at college, was that that most men on autopsy, they find some degree of prostate swelling. So prostate swelling is something that most men are going to have a tendency or an issue with at some point. Maybe not to their latter years, but it is something really to be vigilant about. Prostate cancer, on the whole, tend to grow very slowly, but early detection and treatment can significantly, make a big difference. And whether it's a watch and see type scenario or whether there's more radical treatment involved, early diagnosis means that you're forewarned is forearmed, and you've got much better handle on it.
Peter, some of the symptoms that we might have a bit of trouble in the prostate area, what are some of the big ones that fellas should be paying clean attention to?
And again, this is one of those things that us fellas or us blokes tend to just ignore these sorts of things. So it's anything to do with passing water. One of the early signs of prostate issues can be where you tend to pass water all right during the day, but of a night time, for some reason, getting up during the night, you might start to get up more frequently during the night, or you might have to wait a little bit for the flow to start, even though the pressure seems fine during the day. So for some reason, it can be a little bit of incontinence sometimes as well, where there's a little bit of urgency with getting to the toilet, weak urine flow we've talked about, any pain during passing water, erection difficulties, even an unusual symptom can be things like recurrent pain in hips, thigh or lower back.
Okay, that seems a bit...
which can be, it can be a whole heap of things as well. But if you're getting those sorts of symptoms associated with...
So what's the correlation between your back or your hips to the prostate?
I imagine it's it's a referred pain, basically.
Fair enough.
Yeah.
Okay.
Yeah, but as I was saying, most men will get some degree of prostate swelling as they get older. Maybe not till they're much older. So it is something to be vigilant about.
And I guess with any of those things, then comes the thought of, need to get checked out, need to get on top of these things. What's the next step?
Getting tested.
Mm-hmm.
So PSA, blood test, or the digital examination. And then from there, if there's concerns, then maybe they'll look at doing like a biopsy, where they're looking for abnormal cells in the prostate. And then from there, determining whether it's a less aggressive or a more aggressive type of cancer, and then working out a treatment program from there, from a medical point of view.
Just back on, I guess, the prevention side of things, from the natural therapy side of things, what are some of the things we should be trying to look at there, particularly to try and prevent or stave off prostate cancer?
Well, look, one of the, as we've talked about before, increase in your intake of vegetables and fruits. These contain essential antioxidants, micronutrients, crucial for your health. And just being really specific about that, like what's great with new information coming out is things like tomatoes, for instance, are particularly good for their high levels of lycopene. So lycopene is a naturally occurring compound in tomatoes that's been shown to help with prostate inflammation and prostate swelling.
I'm glad to hear that. I think I have tomatoes about 5 days a week, so I think that might be on the good side.
Well, that definitely makes a difference. Now, the other, one of my favourite cancer-busting sort of nutrients is broccoli. So it contains a particular type of compound called a sulforaphane, and it's been shown to mobilise natural cancer protection resources, reducing the risk of malignancy. And what it appears that broccoli contains the necessary ingredients to switch on genes. This is exciting stuff. Switch on genes that actually prevent cancer, and switch off ones that help it to spread. So how clever is that? And the amount, previous research has shown that men who eat broccoli show hundreds of beneficial changes in genes known to play a role in fighting cancer. And best of all, you don't need to consume massive amounts. So previous studies have indicated that men who consume more than one portion of cruciferous broccoli vegetables per week are at a lower risk of prostate cancer.
And what would constitute one particular serving?
Well, one serving of broccoli equates to about 2 spears.
Okay, so again, not a great deal.
It's not a lot. So if you're so that's one portion, but if you can do 3 to 5 portions a week, it's not a lot of broccoli that you have to eat. And the other thing that broccoli has been shown to be beneficial for is making sure that estrogen's being cleared from the body effectively, because estrogen in men can play a role with prostate cancer development and prostate inflammation as well.
Particularly when you said that all these things are crossed over, so it's a bit freaky stuff to think that some of the basics we could be doing, eating broccoli. Why are we not doing that every day?
Look, the top foods, or the top things, before we get into supplements in the next segment, are the tomatoes for the lycopene, the broccoli. And broccoli is one of those vegetables. We've talked about this before, but if you can get broccoli and it's organic, I think it's worthwhile trying to source, because it's an open flowery vegetable that's going to pick up more chemicals or toxins than maybe something that's
something like a banana
skin
that you're going to get rid of the skin from.
Yeah. Green tea. So green tea, 3 cups of green tea a day, good quality sencha green tea. We talked about that before as well. So if you're having your 3 to 5 serves of broccoli a week, your 3 cups of green tea a day, and half a pint of blueberries, already you're choosing some of the major anti-cancer nutrients, and it's those things over a long-term period that really seem to make a big difference.
Yeah, not just for prostate cancer, but for health in general.
Yeah, look, it is, and as I said, it's the second largest cause of cancer death in Australian men after lung cancer. So it really is a big thing. And interestingly, the guidelines or the recommendations for helping to avoid and support people undergoing prostate treatment is the same as that for breast cancer, again because of that connection with the hormones. So optimizing your vitamin D levels, getting your D checked and making sure your D is good if you're looking at prostate prevention or you're undergoing treatment. We've talked about before controlling the insulin levels. This is a massive thing. So getting your weight under control, losing excess body fat, reducing carbohydrates. Sugar definitely is taken up by cancer cells preferentially over normal cells. So sugar feeds cancer is the old saying. It's not as simple as that, but it's not a bad way to sum it up. So removing sugar from your diet. Exercise. There's been a lot more research coming out about exercise helping to reduce the risk of mortality from both breast cancer and prostate cancer, and even some centres in WA where they're using exercises while they're undergoing chemotherapy and radiation therapy.
So what is it about exercise that sort of turns our body on to being anti-cancer, I guess?
Well, probably nothing we do has such a profound effect health promoting wise on every single cell in our body as 30 to 45 minutes. So when you produce positive endorphins, you help to reduce insulin resistance, you initially increase inflammation, but then you turn on anti-inflammatory genes. It has a whole myriad of responses that it helps with, but exercise is critical. Avoiding dairy, I'm a bit of a big fan of if you've got a risk of prostate issues. Increasing your omega-3, like your good fish oils, etc., for their anti-inflammatory effect. Making sure that you're reducing exposure to environmental toxins and sources of heavy metals. And a really interesting one is avoiding or reducing the consumption of charcoal meats. Like your flame grilled chicken, and
what are you doing to me, Peter?
Do you like when you have meat? Do you like it to be well cooked?
That's the only way for me. Well done and above is kind of the zone for me.
The zone.
Yeah.
All right. Well, high heat grilling causes a protein reaction in red meat, poultry, and fish, and creates a specific type of amine that's been linked to cancer. So, for a long time, it's been recommended that we try and avoid meats that are cooked to that degree. So, it sounds a bit boring, but, boil, poach or steam foods rather than frying or char boiling if you want to reduce your risk of those
And I guess also
compounds.
and moving away from the meat, because you've just devastated me for the day, getting some of those essential nutrients in there as well.
Yeah, absolutely. So things like vitamin E can really play a big role. Selenium, and selenium's low in our soil. It's one of our major antioxidant, anti-cancer, or cancer-supporting nutrients, cancer-fighting supporting nutrients. So selenium, vitamin E, as we said, vitamin D. They're probably the main ones too, and zinc. Always when we think about prostate health, and vitamin C as well.
Peter, as always, a well-rounded program of advice and information. Prostate cancer, some great information there for us. Now, tonight, you have some limited seating available. Only a couple of seats left for your prostate talk. Can you tell us where and when?
Yeah, David Marston, one of our naturopaths, is he's sort of got a special interest in men's health and prostate health. So that will be our second last talk for tonight at our office in Hamilton Street. It's a free talk on at 6:30. And as you said, there's still a couple of seats left. If people want to phone the office, they can get help there, or if they get onto our website.
And how appropriately, with the silly season upon us, your final talk at the end of the month, managing stress and adrenal fatigue naturally. We're going to need that, Peter. It's Christmas time. It nearly is.
Yeah, absolutely. And you know what? Like, for a lot of people, Christmas is a really stressful time of year. You know, catching up with relatives that you haven't seen all year, or just there seems to be a lot of emotional stuff associated with Christmas.
Families, we've all got one.
Absolutely. So for a lot of people, it is a really stressful time. But, at that talk on the 28th, it's a really good talk for anyone experiencing anxiety or mood issues. But I will be sharing my, only once a year, my secret tips for surviving. I actually probably do it on the radio as well. Secret tips for surviving Christmas this year.
Well, I think we've just basically worked out what your last program for the year is going to be.
Yeah, absolutely. And because it happens every year, I think we can get better and better at it as well.
Either that, or just recycle the same material next year as well. Just put a new date on it.
There's always new tips and
yeah, there always is. All right, some great talks around the place. And, of course, next Tuesday, multivitamins. You'll be talking with us on the radio about that.
Yeah, I thought that's a nice, simple place for a lot of people to start to really, support their health.
Peter, that's the program. Thank you for coming in this week.
Thank you, Mark.
Next week, Health and Wellbeing with Peter Mullen at 2NURFM.